If you suffer from chronic neck and back pain, especially if you've been suffering for years, right now is finally the time to get relief in a natural way. By now, you probably have tried things like pain medications, maybe physical therapy, injections, or maybe you've even resorted to surgery with no relief. Well, there is another option you'll want to consider. So we have invited our expert in relieving that kind of pain, Dr. Christopher Miller, here to talk about a specialized treatment program that has helped lots and lots of people, along with Mindy, who we'll be chatting with in just a few minutes, one of Dr. Miller's patients. So, Dr. Miller, let's talk about this. A lot of people have been searching for relief for a long time, sometimes many, many years.
And Terry, that really becomes frustrating for a lot of patients because many times they're doing what the doctors are recommending and it's just not working. Or other times they just feel like they're constantly talking to their doctor about these problems and they sort of get the runaround, and time goes on and they just continue struggling and suffering. And for many of them, it is more than just neck or back pain. It affects their ability to function and live a normal life that most of us take for granted. They want answers and they want solutions.
Yeah, right. And we talk about that. The pain, of course, can be debilitating. And you're able to help with a lot of different kinds of issues that people may face, all associated with their back and their neck.
And these are non-invasive solutions, as you said. We're not just doing treatments to mask the pain temporarily. We have a lot of different treatments in our office that help correct a lot of these conditions to help patients feel better because we're getting the problem fixed and getting their spines healthier. And that's really our goal, is just get these patients to a point where they can function again and live without that pain and live a normal life once again.
Yeah, and you have a specialized treatment program that you use, the DRX 9000. Why don't you explain to people exactly how this works? Why is it so effective?
So Terry, this is a medical device that's used to heal and repair degeneration of the spine and injured discs. And the discs are pads and spacers between the vertebrae. Over time, with stress and neglect, they can become very degenerated. Sometimes they bulge or herniate, and these can put pressure on the nerves and cause severe pain, or it could be issues in the extremities, the arms or legs, whether it's numbness and tingling. It could be shooting pains or even weakness, where sometimes they have trouble walking any length of time, standing and doing chores. But again, we can take patients that are down near this end with a lot of pain and actually move them back in this direction where they're getting much healthier.
Yeah, Mindy, why don't you tell us exactly what's going on with you? It wasn't what we would traditionally find as back and neck pain for you.
Well, I did have severe back pain, but mine also included neuropathy from my knees down, and it was a lot of pain that I was dealing with, a lot of falling, and I didn't have very good balance or coordination. And after being at U of M and some other places, they had discovered that my spine had some
was it degeneration that was going on?
It was.
Okay.
It was degeneration, and it had some areas where there wasn't any padding. It was kind of bone on bone, and they were looking at fusing some vertebrae together and putting a possible pouch in my back that would deliver some medicine to my nerves that would just kind of help numb the nerves and the pain. But there wasn't any other options for me. So at that point, I had run out of hope and any idea or any
other options really for treatment. So, Dr. Miller, on this model here, it sounds like by what Mindy's describing, maybe she was all the way on this side, that it was really kind of bone on bone?
Well, Terry, that MRI we have up was Mindy's, and those arrows were pointing that she had degenerated discs in her lower back and bulging discs. But if you look at these models, she was down towards the end here. It hadn't quite fused on its own yet, but it was very bad, and the discs were pushing right out into her nerves. And when I showed Mindy and her husband the MRI and showed them what was going on, I think that there was a lot of hope that finally they had an answer as far as what was wrong, and I was able to accept her case and help her with our decompression program. And
yes.
Yeah, it's improved a lot for her.
So, Mindy, how did you come to find Dr. Miller, and how quickly really were you able to get some relief from this pain?
Well, that is the part of the miraculous thing, is that I had Dr. Miller's number, and name from 8 West in my phone, in that little iCloud that we all keep,
Yeah.
and that from years and years ago. And I had put by that, gotta give this guy a try. So when we came down to the last option and coming back from U of M and knowing that my only option was surgery and this pump that was gonna be placed in my spine, I really didn't want any more back surgery. I didn't want anything else done. I felt like I needed to meet with him. I needed to hear the plan that he was gonna go over, that laid out before me what it was gonna look like, what the plan was. And then when he told me, I need to look at this and make sure that you can be a candidate of this program, I was at first like, how can I not be? But I appreciated that he was not going to just accept me, take the money, take the insurance, and not make sure that I was going to be successful, which I had a lot of respect for. My husband and I both walked away from feeling like we respect that he's going to really thoroughly look at this and ensure success, that something was going to come of this.
How are you doing now?
Wonderfully. Like it is by far, the pain in my back is better. I've improved my balance, my walking, and now my coordination on the last 5 weeks of this program is the Spine Force machine, and that is improving my coordination. So because I had been given a diagnosis of ataxia, which is a cerebellar brain disease, it has not only helped my back, it's also helped the coordination and balance that I never dreamed would be so beyond hopeful. It's just given me my whole life back.
Wow, that's incredible. And Dr. Miller, if people are interested in stopping by to see you in your office, I know that you have a special for 8 West viewers.
We do. If they call our office today, they can schedule an appointment for $47. We'll do a consultation and an examination so that, we can confirm what the actual problem is causing their pain and issues, and, find out if they actually qualify for a decompression program, if we can help them like we've helped Mindy.
And you've taken special precautions with the coronavirus.
Yeah, Terry, I know that's a big deal, and we do make sure that patients are not in one big room all together. We bring them to separate rooms, so they're in their own individual room. We're sanitizing, before each patient after they leave, and we do promote 5 healthy habits. I think there's something to be said for not only preventing spread of coronavirus, but doing things to help improve our immune system and get us as healthy as we can be to fight these diseases. And we talk about things like exercise, rest and relaxation, positive nutrition, a good mental attitude, but also a properly working nervous system, because our nerves control everything in our body, and chiropractic care has been shown to help boost our immune system so we can be as strong as we can and fight off a lot of the sickness as well.
Great information. Thanks, Dr. Miller. And
Thank
Mindy,
you.
thanks for sharing your story with us.
Thank you very
I'm glad
much.
you're feeling better. And I'm glad you watch 8 West.
Yes, I am too.